Hi, Cindy, can you hear me?
Hey, hey, Cindy.
How's it going, Candace?
Good. How are you?
Pretty good. Tonight's agenda won't be, I don't think it's too long.
I'm looking forward to that.
Yeah, I know. We had a couple of changes, so tonight should be pretty brief.
Okay.
Yeah.
I thought you were going to say we've had a couple marathon meetings, and I feel like that's true.
Yes, we have. We've had a couple of lengthy ones recently, so.
Hi. Can you hear me?
Loud and
Yes,
clear.
I can hear you, Cindy.
Hi. How we doing?
We're doing, man.
We're getting through the week. We're so
How's it going?
close.
Yeah.
We're so close to Thanksgiving.
Oh, I'll be back, by the way.
Oh, you'll be back on Monday.
Yeah.
All right. Everything went well down there?
No,
No. Oh gosh. Oh no. Okay.
it's okay. We'll be good. We'll be all right.
Okay.
Gotta stay
Cindy,
positive.
I
Hi.
feel so bad for
Yeah.
you.
Well, you know, I'm very lucky. So just put it that way. Yeah.
Okay.
But the area is not good.
We
No.
don't know if we'll be able to go down there this year because a lot of the places we usually go to and everything. But we have a nephew down there in Venice, and they just got their new walls up and paint. That's
Oh,
it
no.
from the whole house. Yeah, they lost everything.
Yeah. It's bad, but well, like I said, everybody will bounce back. It'll be better than ever.
That really stinks, Cindy. I'm sorry. Your place got destroyed, damaged.
No. I'm the only one no, I have no damage.
What?
None.
Wow, that's great.
No, I'm very, very lucky. Yeah.
Everybody else around you?
Yes. It's insane.
Wow.
Yeah.
Crazy how some people told us like they live in Fort Myers, and then a few of them all live around there, and like they were saying what they lost only, they were so fortunate, was the lanais around their pools.
Oh.
Can you imagine? That's it. But the house across the street, gone.
It's really unbelievable.
My aunt in Bonita Beach lost everything. Their whole condo complex was.
Oh,
You know, they didn't talk much about Bonita, but they got it pretty bad.
yeah, they did. Sad. Naples
Yeah.
did too. Terrible.
All over. But they'll rebuild. They're already working hard. There's Laurel.
Okay, looks like we have Laurel. Laurel, can you hear us?
Yeah, sorry. You can only get into this meeting if you're in Cherry Dalton's. Like you can't cut and paste. Never mind.
Oh, you can't. No. You know what's the best way I find now is to go on the town website.
Yeah.
And go in that way. It goes in the fastest.
I have to do that. That's how I have to
What
do
I
it.
do.
In
Yeah.
the agenda, when she attaches the agenda, which basically has like.
Yeah, it doesn't. It won't recognize. It won't link. Does it link for you? So that's the problem is like you're on the agenda, you think you can do it, then you try to cut and paste it, but it's PDF, so you can't cut and paste it. And I'm like, God damn it, all right, we're being recorded. Never mind.
Okay.
Oh, I open the agenda on the Wakefield town website and it works for me.
Right.
Yep.
Yeah. That's the only way.
It's just
Sad.
a few too many steps when I get home from work. But anyway. Nice purple.
All right, friends, 6:01. 11/16/22. Let's call this meeting of the Wakefield Board of Health to order. Who do we have? Cindy and Elaine Silva and Laurel Gorville, Anthony and Aaron and me.
All right.
Welcome. Are there the agenda is still the agenda, right, Anthony?
Yes, correct. But I'll let you know. So Carol's Cafe, we actually ended up taking off the agenda just because we worked with them and they're all set. So
Oh,
no
okay.
longer need- yeah.
Excellent.
Cool.
Yeah.
Well, let me just.
You want to review the minutes?
I felt okay about the minutes. Anybody else have any feelings?
I approve.
It's awfully hard. It's awfully hard to gather. You know, I would just, they were fine. I just think, Cindy, it must have been brutal because you were trying to do it. I almost sort of feel like in a meeting like that, you do bullet points because I'm like, it's pretty close to what we said. So, I'm fine with them.
I'll take a motion to
I'll
accept
make a
them.
motion to approve the meeting.
I'll second the motion.
Excellent. All in favor?
Orville, aye.
Silver eye.
Linda Hand, aye. So moved. Excellent. Next on the agenda, does anybody have it open? What is it?
Oh, it's just Lake Hugh quality reporting.
Oh yeah, who's on that?
Yeah, so we were just going to give you guys a little bit of an overview. I think this is probably going to be a longer discussion, but essentially with Lake Hugh Town Council, I believe it was either last night or the night before, approved roughly $800,000, I believe, around Lake Hugh maintenance. And so they focus a lot on surface drainage and looking to shore that up and making sure that we're doing, some of the preventative measures that we can to prevent, contamination for Lake Hugh. I know that there was some interest prior from friends of Lake Hugh and some residents about, the quality, and we had the algae bloom earlier in the fall or late summer, fall, I think that time frame. And so in the past, we have put up signs and communication regarding, safety. Essentially it's not swimmable water. You should not be letting your pets in there. If something were to happen and you were to, have the water on you, we would advise washing off and showering off. So that continues to be, some of the measures that we're taking. But I think that there was some discussion, and Aaron, you can kind of chime in, but I think there was some discussion about whether or not we can get Lake Hugh up to kind of a swimmable water quality. And the answer really is, I think just based on the conditions of the lake, it's probably not. It is a very shallow lake. It has, a huge potential for contaminants. And so to have kind of a sustainable effort, even if we were to clean it and get it up to that certain standard, to maintain it would be a huge cost. And so I think some kind of, some simple preventative public health measures can be put into place to prevent, people from going into the lake.
Like certain watercrafts, like I've seen folks on wind surfers, like I feel like the potential is, or stand-up paddleboards, like the potential is kind of high that you're going in the drink. If you...
So let's, Elaine, maybe you can help us with the history. So true. So once upon a time when Elaine and I first got on the board, I had a heart attack. I think Elaine, actually it was just before you got on, because there had been an agreement with Burbank Y to do a
camp. Yeah,
no,
triathlon.
Triathlon.
Yeah, that's right.
In
did,
2009. And so, we have no swimming posted all across the lake, and yet people are swimming, and the cops are like, what am I going to do about it? These people are training for a race. So, I want to bring this back as well, but I made a bit of a fuss saying, okay, if we were celebrating that the lake was swimmable, I'd be all for this. The lake is not swimmable. At the time, friends of Lake Quinnipiac were doing their own testing, and they were letting us know. And that, and that was a volunteer basis, and that's not sustainable. It was very nice for them to do that. But I think we really need to understand the historical use of that lake. So you have the Colonel Spalding Park at the far end, right? Next to Frank's thing. And that looks like a beach.
It was a beach.
It was.
My children learned how to swim there.
Right,
and that was a huge place. And there was lots of boats on there from the 1980s and 90s. And that's when they discovered how bad it was getting.
Yeah. And and I think we used to treat the lake with copper. So I just think it's very important for us to be sensitive to the historical memory of folks who, learn for old times and go, well, my kids swam and they still have one head. But, more importantly, I think it's just very important to you know, go back a step, remember the expectations of some people's memories, and be very clear as to why we can't, you know, that it's not swimmable.
It's not.
But in the meantime, we have the yacht club, which is, you know, a very good club, very good service, and they have little sailboats and little races, and they have, you know, I'm sure they have paddle boats. And then we have the Boys and Girls Club, kayak and board thing. We even have a board race. We have a canoe race at 4th of July. So, you know, the assumption is that people aren't going to spend an incredible amount of time, but we have to kind of, we just need to be aware, I think, of people's expectations. And I do think that it's reasonable not to survey the lake quality such that it comes to the standards of swimming, but that we do occasionally, and we have certainly done this in the past, put out alerts for super high blue-green algae levels that would be harmful, you know, if a dog popped in. And it, you know, and it was interesting is it did, you know, I did a little research before the biathlon as I was having my, you know, as I was quite concerned, and the amount of water that someone who is racing swallows is exceptional. You know, the exposure is exceptional. And this is, you know, what is interesting is these things get approved not by the board, like the Board of Health kind of got a, hey, what do you think, after everything had been done. So this is kind of, you know, an example of being alert, keeping in touch with our town councilors, and, you know, if there's anything that they think remotely involves us, and I would argue that everything involves the Board of Health, and you know, or you can make it involve the Board of Health. And just, you know, I just want to be on record tonight that we revisited the potential of a swimmable lake. It is not a reasonable expectation. It would take an amazing amount of resources with current knowledge and standards of what a swimmable body of water would look like. And that we are, you know, and that holds, right? You know, until further notice, that is the rule. But, you know, I think we haven't said anything officially for over a decade. And in the meanwhile, that, you know, kayak and canoe program gets, you know, continues, and we just have to walk that fine line. Because, you know, people say, well, if I can, you know, as Candace just said, if I can be in a watercraft on it, why can't I swim in it? And it's two different things. Get exposure is one thing to your feet, not a great idea, but, you know, even an incidental, if you're exposed, please rinse off kind of thing. I mean, the way we handled that race was we insisted on a rinsing station as they got out of the water.
Oh, so it actually happened?
Oh God, it happened, and it happened the next year without our knowledge. It just happened. Yeah, it did.
Most of the people who have been here or, you know, grown up, respected that lake, and it was their beach. It was a beautiful beach. They had a great swim program. It was wonderful. And people still think of it as being that way. But once it started to close, they actually had motorboats. I don't know if you remember them, Laurel, on the lake, and actually did water skiing at one time there when I first moved up.
My mother remembers the dance hall.
Yeah, well, yeah, and the Chinese restaurant and everything. Oh yeah, it's where we went for lunch. We went swimming and then we had lunch. You know, we made a lot of good friends, and had some great times up there. But I think that we have to remember is that the lake seems to be a very big attraction here for the walking, and people look at it and they think, wow, look at this. Why don't they use it? Now, is there signs that you cannot fish there? Does anybody know? I can't remember seeing one. Do you?
There's a fishing derby on the 4th of July.
Well, yeah, I know they have that one.
So again, you know.
I see people fishing all the time.
Yeah, I thought I had a couple of times when I went by, but then I thought I was cuckoo, but you know.
They kind of dig down along, I feel like along the Main Street side. They sort of there on the steeper edges.
That's where those big giant yellow fish are or something. I've seen them when I'm walking, you know.
I can't say I've seen a no fishing sign there. Not that I can remember. I think
so.
There's one that says don't bother the geese or something, but I don't see a no fishing sign.
So it's one thing to fish, it's one thing to eat the fish. So I don't know if
Yeah.
we can revisit this further.
A sign that says like the fish have to be thrown back or shouldn't be consumed.
Yeah,
Yeah, that's
Yeah.
good. Yeah, Erin, that sounds really good.
that's what I just feel like we're kind of, we're not paying attention, like to this because we have not been responsible for testing it, but at the same time, we need to be aware of the behaviors around the lake, and we need to be mindful of, things have happened, right? We've done better at these information kiosks, and so I wondered, did we reach out from anybody from the Friends of the Lake, FOLQ?
No, we didn't. It's because I think we wanted to have a discussion first, and then kind of get our position and make sure that we have all information before we bring them in.
So I think it would be a good idea to reach out to the FOLQ. They had wanted a Board of Health member to attend some of their meetings. None of us have been able to do that. That was maybe 5 years ago. I don't know, in a while. But I think it would be nice. I think we should be communicating with them because I think it's important that we're responsible as a health department saying, this is a condition of the lake. These are the recommendations. However, you can certainly enjoy we enjoy being around the lake. You enjoy being on top of the lake. People are allowed to be in a boat. If they fall in, it's recommended that they shower. The amount that you swallow if you tip a boat or fall in, generally you're not, generally it's not to the level of a race. That's a mile and you're ingesting water as you're going as fast as you can. So it's a different thing. I just want to be mindful of one, being clear and kind of the optics. So I don't want people to be afraid of the lake, but it's just not swimmable.
What other local bodies of water that are similar? Like, yes, you can use them and use these bodies of water in some way, but you can't swim in them. Are there others around here that are similar to that?
L Pond.
I was gonna say L Pond is
L
one
Pond,
definitely a
you
good
can
example.
sit and walk. Yeah.
And so, like, could we could sort of see like what sort of signage do they use, and like what about like what kind of information do they have available for people?
L Pond has some no swimming signs. There's also information on not letting your pets into L Pond. So we have something similar, I think, around Lake Q, but it's we can make that signage consistent, I think.
And then the opposite of that is in Stoneham, what's that pond? Spot Pond is a reservoir. So you can boat in there, but you can't bring your boat in there. Like I got chased down. I'm like, it's only been in my backyard. It's not been in another body water. It certainly hasn't been in Lake Quannapowitt. But so I think it might not be a bad idea just to be familiar with Department of DCR to see, because DCR is responsible for the lake up at Braycart, which I don't know if the pond part is Saugus or us, but the end of Braycart is Wakefield.
That's Saugus.
That's Saugus, yeah.
Yeah, Saugus.
It becomes Saugus right there. But even just kind of understanding the water rules in our region and just being prepared, even not that it's our concern, it's Linfield's, but even being aware when and if this bike trail ever finishes across their wetlands, same sort of, I just feel like if we could just have a coordinated effort with information, it would be helpful.
Well, I was just say it's a good point you bring up, because I think the Friends of Lake Quannapowitt have pretty good visibility within the town of Wakefield. Yeah. I think this is a good opportunity for us to kind of collaborate with them, because I know they're somewhat they're pretty active on social media. And they've got a good team, so I think it's a good opportunity for us to use their platform too to reach out to the residents, right? Because they have some historical knowledge, like you said. So.
Yeah, and I don't believe that. I don't know. They've never asked us to make the lake swimmable, but again, in concert with their efforts for people to use less fertilizer for the runoff that then causes the blue green algae. So I'd like to see a collaborative effort.
Sounds good. Yeah. So
I think that, yeah, just the signs alone being up and maybe something on our website to remind people under the health department too. And then that way they're going to know and understand. Because I think people just feel that there's boats out there, there's this out there. Why can't we go in to swim? They just don't, understand. And why can't my dog go in there? If I throw the Frisbee in there, can the dog go and get it? No, not really. But you want to wash them when you get out. You got
But
plenty
that
of
big floatable duck is fine.
Yeah, that's fine. That's cute. And
That's, that promotes the health and wellness and happiness of
it's
So I'll say, I think timing wise, I think it'd be great if before, so as we're entering the cold season here, this may be less pertinent to less pertinent to lake use right now. But as we enter kind of the spring season and we get closer to the warmer weather, people going back onto the lake to do, to have those water activities, I think it would be good for us to have a plan going into it and release some information in collaboration with Friends of Lake Q before kind of spring really comes around. And if we release it by then people will have that fresh kind of knowledge and will see it before they go. So they can kind of plan
I
that sort
think also
of
that
thing.
you would invite the yacht club.
Oh, good idea. Yeah, so we should invite the yacht club. And,
So,
What about who runs the boating setup right at near the church?
Boys and Girls Club.
Boys and Girls Club, yep.
Yeah, so if you have those entities all at the table, just to say, because we don't want to, I don't want to cause a stir that would affect their usability, but I do would, it would be nice to have a meeting with them just to say, what are your concerns? What are lessons learned? Do you wish that we had more posting? Do you want us to stay on? Too late now. So I think as a community collaborative, those would be the stakeholders that we should be involved with.
That's a great idea. Yeah. So I think we have plenty of time between now and the lake's peak usage season again. So it'd be good if we had a meeting pre-season start. Have like you said, the yacht club and Boys and Girls Club and Friends of Lake Q. Anybody else we might think of that might want to be in on this and just
I would loop in fire, emergency, and police because they respond to things there.
Yeah, that's good.
And the fire department is often doing ice drills.
Oh yeah, and Bill Renault too.
Yep, Bill Renault. He's our town engineer. He's actually going to be the lead on the surface drainage project for Lake Q. So it'll be good for him to be tied into this too. So.
Yep. And then probably let the one person in town council.
Yes.
All right, I knew that you were bored, so I gave you 5 more things to do.
Yes, we have plenty of time. Yep.
I think Carol's is not on our agenda. Is that your report next, Anthony?
Yes, just the report. Pretty short and sweet. Our peak clinic season is over for the fall. Thank you to all of the volunteers, all the staff, the Board of Health for making this possible again this year. We had a pretty decent show this year. We had a total of 698, so nearly 700 doses given out between flu and COVID. We ran a lot of regional clinics. We were able to run a lot in Wakefield and run some in Melrose. We made it pretty accessible. We also had a lot of drop-in clinics in the department. I believe, Cindy, was it every Wednesday, right? Correct? Every Wednesday, and I think we also had some on Fridays too. We had some drop-ins on Friday.
Yeah, with COVID and flu. Yeah.
COVID and flu, yeah. So we ended up giving out a lot of shots, and I think the walk-in model seems to have the drop-in model seems to have been very successful. Yeah,
it is.
They're loving it.
Oh yeah,
it's not
And I think it's been great for Sandy to get to know the community that way.
Yes, Sandy has been able to interface with a lot of people. People are getting to know Sandy and what she does. And she's also, I would say, her and Melissa have been making a lot of home visits as well for those that are homebound. That has been incredibly helpful for those folks. I know the state had started back up there or had more capacity for their homebound visits, but I think they've been very comfortable with having our local health department kind of be more involved and come out to them. So it's been a good season. Yeah. So
we're thinking about the challenges and the thoughtfulness that goes into this. So Elaine, you may have some more thoughts, but I'm just sort of thinking historically how we did this, right? So years ago, but nursing had control of the vaccine. The health director ran the whole thing like an emergency drill, and there were, I was really reminded during one of the clinics that like the nursing piece is pretty buttoned up. But now with the late, it used to be people would come in, do their paperwork. We didn't used to, I don't think I think, a decade ago, we weren't able to bill. Then we were able to get at least a little bit of slice from insurance. So that took paperwork, and admin had to drudge through that and get it done. Now we've moved to color, which in the front end is slower, and the back end is probably helpful, but definitely there's the have and the have-nots in tech comfort, and it's not necessarily an age demographic. There's lots of pockets of people who, for good reasons, don't want to have access to QR codes and such. And so, and I think we've gone through several runs where it was supply and demand. So, before COVID, we were kind of like, oh, we don't know what we're going to get. We're not going to know what we get until August. We never had as much high dose as we had this year. Like every year is different, but I think we respond on supply and demand. And I'm wondering if we could think more thoughtfully next spring about where would this really, like, what are we missing? And so yesterday in the Wake Up meeting, we had the opportunity to sort of talk about our social determinants, kind of getting back to that pre-COVID. That was our mission, was to kind of understand where the needing pockets were. And so I would just recommend that I think that when I was looking at the numbers for drop-in, I said, I think that's the way to go. If no one comes, the nurse can still get work done. If people come, you get it done and you don't disrupt a whole bunch of people at the same time.
I think you're right, Laurel, but I know that in the history here, the clinics weren't run as I was used to. I don't know if Erin was used to where she was. We ran them through our region as a drill every single year. We had our flu clinics at the same place. Every week it was on the Han. It was a call down. Everything was done like that. But I don't think this region, I don't know how they do it. I came from a big region of 40-something cities and towns together. And that's how we run it. And that's the same way they still run it. It's run as a drill right down. And I think sometimes when you do that, it does help with in the case there really is an emergency. You're just so used to doing it. And I always found that the residents were so used to going and knowing when it was, where it was going to be, what it was going to be like, that even with the change in color, some of them didn't have much of a difference, except to go on. It's very difficult for some people. They're not techie, and I'm one that's not techie, but I'm good with color, though. I know that. I'm pretty good with that. And I think sometimes that we have to be reminded that when we do these flu clinics, it should be part of our emergency preparedness training and part of our doing. I mean, I don't know, Erin, where you were, but we used to have to do 3 or 4 call downs a year, announced and unannounced, and the paper came out on the Han, and we knew who responded and who didn't respond, what the response time was and stuff like that. So that may be something that we may look into. Anthony, you know how I am a big EP person. So
yeah, I think it's been good because I've been able to work with Alan Albert and Melrose, Tom Walsh and Wakefield, where we're starting to kind of shore up some of what we're going to be doing. We're narrowing down some of the larger clinics, I think. So we're going to be doing some, less of the smaller clinics. Some of the bigger clinics we'll still maintain, and we'll have the drop-ins. But I think some consistency would be helpful, especially for the emergency preparedness side. So at least we know kind of where we're going to be at. Because now it's been 2 years where we've been able to utilize the Civic Center, and we've been using Memorial Hall. So these will be places that we can kind of run this a little bit more of a drill. So yeah, absolutely.
always works.
Oh, yeah.
In my past, where I was, we always did. And it worked out, especially at this time of the year when there's so much travel and there's people going from state to state or children coming home from colleges that may have missed the opportunity to get the flu shot. And this is when they get the time to do it. And I've heard a lot of people locally that have used the drop-in and they were very, very happy with it. Totally happy.
Yes, absolutely. Can
To
I?
Erin's point, just, you know, and just to Erin's point is before H1N1, when pharmacies were deputized to take over some of these vaccines, it really was our community assessment.
Yeah,
it was pretty cool. You know, how so and so doing? Are they still here? It was, you know, it was a nice eye on the community. I feel like we're maybe getting back to that. I do feel like pharmacies are being, you know, as a prescriber, I'm really feeling that they are overtaxed with their, I think they're spread way too thin.
I'll say I heard the same thing, especially at Town Day. A lot of our residents were frustrated with pharmacies, and they were very happy that we had like such a robust service available at Town Day. I heard that from more than one person. And I know, like, personally, like, my own kids got vaccinated there because it was a hassle to make an appointment at the pharmacy. And it was just so much easier to come out on a beautiful day when there was a bunch of other stuff going on. So yeah, I think you're right. I think it is challenging. And being able to have vaccine available for so much of the community, you know, high dose, pediatric, adult, like have that all in one spot.
I will also say, I don't want to forget to mention the Wakefield school nurses were very, very good this year, just as they always are. But they vaccinated, Cindy, correct me if I'm wrong, like around 170, is that right? 180?
173.
173. They vaccinated their own 173 people. It was a great effort by them, you know, on top of everything they do during a normal school day. They also managed to do that. So they did a great job to bring the vaccine to the staff. So
yeah. And their history's always been great. They just had the last couple of years where the color, they didn't want to, you know, they did a really good job this year, but they learned color.
It was a lot. Yeah, it was a lot to ask them to pick up basically a new system that we had to spend our full-time jobs doing, right? We had to learn it. But
the lead nurse, she came to me and said, can you just show me how to do color? And we want to go back to vaccinating on our own.
Yeah, so Kelly Cooley did a really good job. Yeah.
So can we, I think that's wonderful. Can we just write an official note to Superintendent Lyons and just say, you know, on behalf of the Board of Health, we commend the effort for the school nurses to manage in-house flu vaccine.
Yeah, I think that's a great idea, because that was a big, you know, they each nurse at each school learned color and vaccinated their staff, and you know, their numbers came close to what they had been doing for years, so which was great.
Do you want one of us to visit a school committee meeting, or do we want to draft a letter and send it to Doug?
I was going to say it'd be great if we could draft a letter. I think Doug did ask for us to come to a school committee meeting about a lot of the efforts that we're working on at the schools anyways, but I think it would be good for us to send a letter and address it at one of these upcoming meetings.
All right, let us know. One of us could probably.
Yep, that would be great. Okay, so that was it for the clinic update. Did everyone have a chance to review the reproductive health rights statement? That came in the packet, right? Yeah, okay. Yeah. I don't know if you guys had a chance to review it. Just let me know. Was that kind of in line with what you guys were thinking, or?
Yeah, I like the quote at the end too. I felt like it was pretty clear. I don't think it needs to be flowery or 3 pages long. I think we just need to sort of make the point, and then where is it going to go?
So that was the other thing I was going to ask. So the different towns taking different approaches. I think we should have it available, widely available on the town website. I think we have a Board of Health the Board of Health page by itself, and then we have a health department page. I think, you know, this is written specifically as a joint statement, so we should have it available on both sides.
What
But
about like the town council page, if they would consider like having it there? I mean, of course, like we control our corner of the internet, but I wonder, I mean, that
yeah,
would be great if we could, you know, if they would be willing to do that.
I think that would be great to ask them for consideration to see if they would like this on their website as well. Yep.
So I have to share that I'm a little uneasy.
Okay.
I would be more comfortable just saying, you know, full reproductive care without being explicit with saying including full abortion care. We're not clinicians in that respect. I'm good with an umbrella term. None of us are politicians. And I just, to me, it's a, you know, it's a, like every one of us as a board member is signing off on this. And so it's a very nuanced issue. You know, as people say, I want reproductive rights for everybody. What I would do personally is very different.
Sure. Yeah.
I just want to be aware that we're serving everybody in the community, and I don't want anybody to look at that, a word that may be somewhat cause an emotive reaction, and for them then not to ask for help from us because of that statement. I'm just looking at this from the flip side.
Sure.
I would prefer, we are fully supportive of full reproductive rights in every language, but I'm not great with including abortion language.
Okay.
I don't know what you guys think, you know.
And again, I think you guys, I'll just kind of, you know, so I think the piece about the reproductive health rights, I get that. I think what you're saying is basically, you know, because this is a highly contested subject, I think if someone were to see this, what you're saying is essentially they may not receive the same services or may receive the same treatment from us if, you know, let's just say their view did not match ours, right? Or they did not agree fully with what you're saying, right? Is that kind of what you're getting at?
Not to mention in our world, our own safety, right? Like we're a small board.
Yes.
And we have already been tested with masking.
Yes.
This is
I do agree with you, Laurel. I think it's the part that I was a little confused was committed to protecting access. I mean, that's saying definitely like if we were the type of health department that had an insurance, you know, access with us that, you know, for Medicare or for, you know, Mass Health or something like that. And it's kind of taking I thought it was a very broad statement, and it just like, it didn't catch me right, to be honest with you. I reread it a couple of times. And I think maybe even if we do write something, I think you should run it by legal just to be sure that the wording is correct. And it doesn't, like Laurel say, make us responsible that if somebody in the town can't get what they want, come back and say, well, it says you're here to protect my access and you said you would help. So, you know, help me. I think we have to probably run it by legal just to make sure that it's just very, you know, I don't know what you would call it, the word.
Well,
because I'll tell you, we did have and there was a rally at the APHA conference. I don't know if you did. I think it was on TV in regards to the abortion things going on right now. And everyone was told that if you did go out there, that it wasn't APH's stand, that it was your own personal, you know, opinion and everything. And that if anything happened, it was, you know, you had to answer for it. But there were many politicians and TV cameras in Boston during this rally outside the conference.
I think I know what you're getting at. So essentially what you're saying is protecting access, that kind of, you know, put some responsibility for the board, you know, to some respect. I think, and, you know, happy to make some edits to it as well. But I think by saying protecting access, I think the next line where it says the board strongly recommends, reproductive health information, legal medical funding. I think that's kind of the action step, and maybe there's a better way of saying it, but that's the action step that we're taking to help protect access, right? I think that's somewhat clarifying
But
what we'll be doing. So,
but we don't have the ability to refer people to anything. Like we don't.
But we can share information, right?
Right,
Like,
yep.
That's I think we're not like making any kind of insurance referral. I think if we could, if someone needs those kind of services, as a health department, we could give information to them about where they could seek those services if they wanted them.
Mm-hmm. So I think that line specifically, I think it's to provide information. It's not so much to then, either make a referral for them. Do you see what I'm saying? It's not like a direct connection to.
Right. I feel like it lets people know that we are another access point outside of their primary care provider, right, or an emergency department, where if they needed that information, we would be a place they could get it. And I think sometimes maybe we may be an easier access point for some of our patients that might not have easy access to their PCP's office. If they needed those services, perhaps a young person could walk into the health department easier than they could walk into their PCP's office and just get a phone number or an address if they need it.
Or even call us anonymously.
Exactly. I feel like the statement, I can understand the concern about the politics of it. And I appreciate Laurel and Elaine, you guys have been doing this much longer than I have. So you probably know a lot more about how that is. But I think the spirit feels like we are saying that we support access to information more than anything.
Yeah.
It doesn't, for me, I guess I don't read it as we're pro this or anti that. It's more like, if you need to know, we can give you the information.
And I think part of it is, and I get what you were saying earlier, Laurel, about kind of, the reproductive health services. And then I think the abortion is kind of like that word that, that word that's creating controversy, right?
It's a harsh word.
I think part of the difficulty of leaving it at reproductive health services without mentioning it, and I went back and forth on this when I first wrote it, was kind of, it leaves some ambiguity. And I think that leaving that up for someone to interpret makes it difficult. Then, if they're already struggling, or if they're kind of trying to figure out who to reach out to or needs help, I wonder if they're that kind of doubt, they would not reach out to us. That was just what I was trying to figure out, how to word that so that that's not ambiguous, right?
So Melissa, I see that you're on the call.
Yep, Melissa should be on.
Yes, I am.
So, I don't know if anyone, I don't know what we have for information and referral sources. We are now a Health and Human Services issue. I'd kind of like to hear from Melissa and Jason, who is kind of now the front line.
Yep.
Erin, you're in the inspectional services, but who knows, like we're all kind of, accessing. So I kind of would like to get a little feedback from the staff, and like just march the scenario. Someone comes into the health department, and Cindy looking for this information.
Mm-hmm.
Are you going to just sit down and Google with them? Because sometimes that is what we do, right?
If that's what they need, right?
Right,
yeah.
And that's what it does. But I think we need to be, prepared for that. Going, oh yeah, no problem. We're gonna sit down and Google. I mean, this is a lot of what Jason is telling me. He's learning on the fly, and so we've put him in the food pantry, and he's a lot, from what I hear, he's doing a great job, and he's enjoying every new challenge. But I think it would be nice if we all just had an agreement going, yeah, you don't escalate, you go, all right, let's see what we can do for referrals. And that certainly also includes anything that WAVE may be able to provide for us. So, thinking more system
globally, system-wide. I agree, Laurel. I don't have any sort of file set up for this issue, but sitting down with the person or taking their information and Googling and getting back to them would absolutely be what I would do. And give them a broad range of choices and, help to explain to them, what is out there without applying any judgment.
And I think ultimately, I know when I make referrals for these services, the patient has to call and make their own appointment. So,
Yes.
I mean, you can put the information in their hand and maybe you could sit next to them if they ask, but they need to make the phone call. They need to make the appointment if this is something that they are interested in. So, I don't know. I feel like it's important that people know that we're a place where they can get information, like scientifically based, accurate information.
And I agree. I think it'll be important to kind of tie in Melissa, Sandy, and Jason as kind of our primary points of contact, right? So if someone were to come in, like Laurel's scenario would be, they would be our first kind of, and well, Cindy too, but but they would kind of be our first, point of contact, right? And so establishing some sort of workflow regarding this topic is important, I think, and it's make sure that we're following all the rules. We're not suggesting one thing or another. We're not. We're providing the access and the options and making sure that it is available in multiple languages and make sure that it's in a media that they understand. That's kind of our priority.
Mm-hmm.
Yeah. Yep. And just a quick plug before I forget, actually the Monday after Thanksgiving, we have a town council meeting. We are presenting a social services update to the town council.
Good.
So we are going to be, just because you brought Jason up, so I didn't want to forget.
Yeah.
Ann Danahy, I'm going to be contacting her before this meeting, making sure that she's all looped in, and we're going to be providing an update on that position. The spoiler is that it's going really well. Yeah, so we'll make sure to have, if you guys can attend, that'd be great. I think it's going to be virtual or hybrid, so we'll be in person there presenting, but it'll be available on WCAT as well. So.
Do you know what time it is? 7?
I believe it's 7. I think that's what, or it's either 7 or 7:30. I think 7 might be school committee. I'm not sure, but it's either 7 or 7:30. I'll confirm.
And do you know where we are on the agenda yet? Sooner or later?
No idea. We find out a week before, I think.
Okay.
Yeah.
Awesome.
Is there anything that has to do with us coming up at town meeting on the warrant?
Nope, not the one on Saturday, the town meeting that we have on Saturday. I think there's only 5 items and I don't believe we're any of them. So I will be there and it should be a quick in and out.
Who picked that date?
It's not like last year, right?
I COVIDed myself out of the spring meeting.
Oh, rat.
Oh, you did. I do remember that. Yes.
Conveniently. I didn't want you sitting next to me.
No, none of that. Oh goodness.
Okay, so I think that's pretty much it. I just wanted to make sure I didn't forget. So it's the statement that we still have, and then I believe. Oh, and I do have a couple more updates, but I just want to make sure I'm not running off too quickly here. So do we want to discuss the statement further? What do you guys think?
Why don't you ask maybe Jason and see if he has a suggestion, and maybe what we need to have is a pamphlet or something there, so that if like Cindy was busy with somebody or Melissa or somebody isn't even in the office, we should have something for there, that if you're looking for something, these are some of the sites you could go to, websites or something like that. That's another thing.
Yeah, that's a good idea.
Like in like the vestibule or anywhere where there is information that folks can grab and go? Yeah,
so we did have this. Oh, sorry, Cindy. I see you're already going, so I'll let you go.
Oh, I was just thinking, once we have our rotating informational board, it's an electronic one like they have at Town Hall going, it's something we could circulate, of information of all the different things that HHS has. So,
and we do have a little table in the lobby. As you can see, our nice shiny new lobby furniture, if you've been there. So we have a little table there. I think we're trying to limit print materials, but not limit in the sense, we just want to make sure that we're not flooding the whole place with pamphlets. So we'll be selective about how we want to present it. So we'll have like, pamphlets available and that sort of thing. Yeah, so it's a great idea to have.
Yeah.
We could talk to Jason and see what he thinks. I still feel like I'm okay with it as written now. But if we need to review it more, then I guess we could talk about it next month.
Yeah, I'd like a little time.
Okay, that sounds good. So instead of having it as a separate agenda item, I'll just keep it in the health director's report, just like this time. So we'll review it for next time. Okay, that sounds good. And we'll also come with some information on just plans for implementation too. So, having our staff kind of all on the same page, how we're going to do that training and making sure that everybody's given the same information. So,
yeah.
All right. That sounds good to me. I have a couple of quick things to run through in terms of updates. So we have actually from the last town council meeting, they passed the heating support initiative. So great work from Catherine and Tom Walsh for working together, and Kevin Gill, I will say he also put in a lot of time into this as well. Was presented to town council to basically use ARPA funds to support Wakefield residents that are facing financial challenges over heating bills. This program is going to be primary point is going to be us, but we're working closely with IT department and emergency management to make sure that we have kind of a smooth pipeline of requests straight to the town and making sure that we're being equitable in distribution of services. So this was passed at the last town council meeting, and we'll be putting together kind of not a press release, but I would say kind of like a rollout of information in the coming days, coming weeks as we go into the cold season here to make sure everybody has access to this. So we'll be using our existing system, OpenGov, to be for the administrative side, and we'll tackle this with the help of Jason as well. So the next up is the update for Jason. So the social services coordinator, the position has been very, very successful very quickly. So we've been able to develop better relationships with the Wakefield Housing Authority, police department, the middle school department, and municipal gas and light. And so we've had a lot of residents come in and take advantage of Jason's ability to navigate all these forms, be able to call the right people, be able to do the things that generally take a lot of time for residents that are already very busy that they may not be able to do on their own. And so in the short amount of time he's been here, he's already worked with places like Housing Families, Elliott, the Citizens Inn of Peabody. We also have Salvation Army. He's also filed a lot of LEO applications. He's helped connect a lot of people to SNAP benefits and even referrals to the Everett Haitian Community Center, Immigrant Family Services, and the food pantry, which was one of the major partners that we had mentioned in the beginning. His role in doing the intakes for the food pantry Tuesday, Thursdays, and Thursday nights has been super, super helpful. I think it's turning into kind of a one-stop shop for people who are coming in and needing other services. So just really good reviews all around so far. And he'll also be a prominent part of this heating support initiative for this winter. So people will be working with him, and he'll be able to help triage some of these requests as they come on. So overall, a really successful position. We're working on, like Ann Danahy had mentioned at the last town council meeting, making sure that our metrics are very clear. I think some of it has to be, your very clear numbers, sources, referrals, that sort of thing. But I think we also need to be very mindful of kind of just the narrative format as well. We want to be able to, talk about the success of this position in the context of the change in this community and people being able to access resources they didn't know existed before. So I think it's a more of a connection to the community and the overall expansion of health and human services. So I think it's been it's been very helpful. So I think actually, I'm trying to look right now, we actually have a estimates. It looks like Jason's helped just over 40 Wakefield residents with field assistance applications. So it's very timely coming into this cold season. We're very excited to see how this progresses.
I think too that Catherine is our machine when it comes to metrics. So hearing that side, you know, it's pretty impressive though. I left my wake up notes in the car, but just the interconnectedness that we have is pretty amazing. It's very, should do Wakefield proud.
Yeah, I mean, Wake Up, and I think the program Catherine's put together has been you know, exemplary. People do talk about it. I know she went to the conference over the summer. She went to CADCA in Florida. They did a presentation there. I mean, it's Wakefield is known very widely for their model. So I think it's definitely something for us to continue in the future. We also even had and actually Aaron was there for the meeting today. We had a housing and homelessness housing task force today, and it was hosted in Melrose today by our social service coordinator in Melrose, Colin McGowan. But Jason was able to attend that meeting, and so the crosswork between the two communities has only increased during this time. So it's been super helpful, and I think with the regional money that's coming through Malden into our region here on the housing side has been very important. So.
I'm wondering if Carol is from the restaurant and is on. I don't know.
Why don't we let Anthony finish and then we can address other folks.
Okay, yeah. So the youth mental health first aid courses have been going really well. I think this season alone, we had over 30 people, a variety of backgrounds. We had people, parents, we had coaches, we had school professionals, we had, you know, just a bunch of folks come. They were able to attend this training. We're running parallel trainings at Melrose, but the youth mental health first aid, obviously during this time, is really important. I think the more people that have that understanding of mental health in this age group is really important. So we're able to get a lot of people to participate, which is good. And they're also able to kind of tell their neighbors, their friends about this program as well. So it was really good. Have you guys attended a mental health first aid training before? Anybody?
I did it many years ago. Started it with, you know, Jamie Ledger. I think she'd come up here a few times. It was very good for CHA. We had to attend it. Yeah, you know Jamie. Yeah, yes, we had to attend it. We were. I
actually called Jamie. Frank Oliveri and I called separately, and she was very nice enough to not tell us that we called her twice. So yes, no, Jamie was really helpful in kind of getting us started, and so our program has been really successful.
But who's doing the training now? Is it Kelly?
It's Kelly and I believe Kelly Tobine, and I think it might have been Julie from our JDP management group. I think it was the two of them that did it, and then Jason Stone and Amy Chiaravolati. I will pronounce her name wrong more than this, but Amy and Jason are going to be trained in youth and adult mental health first aid, so they will then become trainers. Which will allow us to run more of these trainings kind of consistently. So, yep, more to come on the youth mental health first aid and the adult as well. And we'll let you guys know. And if you guys can attend, it's not, the hours aren't very conducive right now, but we'll try and get as many of these trainings up in different times as possible. We had a great de-escalation training. I think a few of our folks were able to attend the de-escalation training. It involved a lot of town staff, and I think it was important for us to kind of pilot this because I think we want to also involve business owners in the future. Just during this time, you know, with a lot of residual from COVID and kind of the isolation and some of the, you know, social anxiety and that sort of thing, I think it's important for us to give everybody the tools they need to, you know, address these potentially hostile customers, and so be able to talk them down, kind of figure out what they need and how to best serve them, right? So I think it's important, and I think we were able to kind of pilot that de-escalation training. So any resources that you guys might know of for de-escalation training, feel free to let us know. We're still trying to figure out the perfect kind of formula, kind of blend of de-escalation types, because I think different stakeholders require kind of different focuses, right? So yeah, we'll keep you guys up to date on that. We have an update on the diversion program. Laurel, you probably heard some of this already at the last Wake Up meeting, but the Project Here diversion program at the high school has been really successful up to this point. They've been able to serve 12 students. Just in general, it's a great program, as you guys probably know about diversion, but just, being able to keep students, in the school, make sure, because I think suspension and just kind of that disruption in their school day is just it's detrimental. And so being able to have this program there is very helpful. So this program continues to be very successful in its implementation. So let's see. We had a very successful ESL family night, and so this was at the Civic Center. Laurel, did you end up going to that one? I think you had mentioned that you might have gone.
I had another commitment.
Oh, okay, so yeah, but the ESL family night, wildly successful. We were able to give out a lot of clothing that night. It was just, having so many different English learning family members come to that event, just getting the awareness out there, getting resources into hands, making ourselves available as well as our Wakefield food pantry. The library was there. It was a good kind of way to connect with our community and be able to reach out to
volunteers out of it,
Did we vaccinate also?
We didn't vaccinate this year, but it is definitely an opportunity that we're looking for next year. We're gonna plan for that in terms of ordering and making sure that that's going to be available. So getting everybody in the same room is very difficult. Everybody's schedule is very tight. So that would have been a great opportunity for us to have that. So.
Candace, Sandy, and I were both out of town, and we didn't have a lot of vaccinators who would be able to go ahead and put together all the supplies and gather all the vaccine. And there were also some problems with color and their ability to provide the materials in other languages. As I was explaining to Anthony, the hello would be in the foreign language, then there would be a paragraph that was in English, and then the button that says click here would be in the language. So you would still need to have a translator to help them understand what they were saying. Now, color has kind of back-ended a solution, but it's still a work in progress. So that wasn't really ready either.
That's kind of a miss on ESL night, right?
So basically all of the important information was still in English. So
that's not going to work.
No, right. Not going to work.
So it's on the radar for next year, and I think it's a really valuable group for us to reach out to. And I had a long conversation with Catherine about how I think we can really organize it better and pull it off. It was sort of initially the brainchild of Catherine and Eileen Dern, but there were logistical issues to try to roll it out, especially since Sandy and I weren't around.
Okay, that sounds good. So yeah, definitely an opportunity that we were looking to offer next year. We have a new public health intern that started. I think this is her first week, Lily Verna. She's been working closely with Catherine and the Wake Up team. She's started out working on a lot of health communications. Her background at Tufts right now, she's majoring in public health and Spanish, which is both very needed right now. So I met her for the first time today. She seems very, very good. She's very passionate about the work that she's doing right now. And I think her work with Catherine and Amy have been pretty good. And it's only been 1 week. So we look forward to seeing what she's able to work on during her semester with us. And we'll I think we'll have her come before the board and just present some of the things she worked on, but before she leaves. So yeah, we've had really good luck with our interns of late. So yeah. A couple last things here. The fitness court that was installed at Moulton Park. I don't know if you guys were aware of that, but that project has been ongoing for a little bit. We'll post pictures. I think Laurel, have you seen these pictures already of Moulton Park?
They're on the internet. Someone put them like on the community.
They might be on the community page already. Yeah. So
oh, yeah.
The fitness court, just
looks good, right?
It looks very nice, and I think there's definitely opportunity. I think we've already touched base with rec department if they want to do some sort of outdoor program. I mean, the proximity to the Council on Aging in Wakefield is just increases its utility. So yeah, it was a great idea, and it's come out. It looks great. So excited for that. And we have a couple of we just have a couple of grants being submitted. So the Winchester Leahy grant. It's to support our English learner residents and address some of the social determinants of health that I think in a previous assessment that we had found results for. And so this is to kind of benefit the food pantry and help with children enrolling in after school activities. So this program we're applying for, I believe we're supposed to find out around Thanksgiving time. So maybe by the next meeting, we'll have an update on that. The Cummings grant, working with with WAVE and with Wakefield Education Foundation, WEF. We actually received, I believe, the original application went in, and we actually received a go-ahead for the second part of the application. So that was good progress. And so Catherine has been able to pull together a lot of these organizations to basically provide all the metrics that we need to sustain this work. WEF has been really institutional for a lot of our students, especially those moving on to college. And so I think this program is really good. And I think the WAVE is a candidate for 100,000, looks like, and WEF is a candidate for 500,000. So it looks like notification will be in the new year, but we'll keep the board up to date on that part. So, and it looks like that's about it. So plenty of things going on.
Yeah, cool.
We're so busy. Elaine, where we've come in a decade.
A long way.
A long way.
A long way. There's a lot of different things here, and being at the conference last week and what I got to see of the conference, unfortunately, but it's the trend across the country is to bring the interest back to public health and to bring back to us public health nurses, which our 100th anniversary will be next year in Georgia, and Melissa will be there. I would hope so. It's going to have a big gala, but it was very, very interesting to listen what has gone on in the country in the past 2 years in public health. We've come a long way, but we are going to come even more now. We will come even more now. We will become, I think we will get back to what we were probably 15, 20 years ago, respected and thought of as a good source of information and treatment, and really can reach out there more. And I think you're going to see a lot across the country come back out. It was very interesting to listen to them all.
That's awesome.
I don't know, I mean, we're all in the field, and private health, tertiary care has like really just tied themselves up in a knot. And, the more they put one name on the same thing, and I am not seeing an improvement in access. And we're really, Melrose Wakefield has has been our neighbor and has been very good at they provide a contact person for us at Wake Up, and we have some communication. But tertiary care centers have just become conglomerates, and I think we're kind of seeing that frustration, that access. So kind of back to a point, that we said earlier in the evening is kind of like, what's the starting point? Where can I just walk in? What is a no barrier access? And I low and no, I think is something that we might want to capture. So that's pretty cool.
Well, don't tell Karen Andrews that.
No, I was naming her as an exception to
Yes.
the moderate rule.
I know.
That's
Yeah,
exactly what I was saying. Like she,
Yep.
you know, like they still have a community hospital presence.
They do.
You know, they still have a heart. They have had to stay in the game with Tufts, but I don't know. We're all, we're all part of. I don't know. It's not like the old days.
It's not. And I recently, this past week, had to be a patient. And it was very, very difficult sitting there watching staffs, struggling to service and with low numbers and with them and watching the people and how they treated the staff. And it wasn't the staffs. I just wrote a big thing up today. It wasn't the staff. I mean, they did what they could and they were very good and the treatment was good, but it's a lot of what you say. There is a change. There is a big change in modern medicine. And part of it is, as we said at APHA, is the access. Where is it? People can't go locally anymore. Everything is just, go here to the big city or go here. There's no more. Our community hospitals and everything are gone. Our community link is gone, unfortunately. It's changed. It's changed, definitely changed. And I learned.
Yeah. So, I mean, again, well, last thing I'll say is I think Melrose Wakefield, is doing what it needs to stay afloat here. But I will say they've been very good partners. Eileen Dern and Karen Andrews, and we still take advantage of the community grants that they provide us with the Melrose Wakefield Healthcare Grant. I mean, they've been good partners, and I think we can definitely maintain a good relationship with them. And they'll continue to work with us in the future.
Yeah,
so,
they're vested, and no, I absolutely cherish that. Let's be reminded that their pharmacist is the one who helped us figure out how to get into the deep freeze in the beginning of the vaccine rollout. So
and they continue to store our COVID vaccines. So
so they've been lovely.
Yes.
And I appreciate that, but I think from the patient access perspective, it's really a challenge. And even with patient records, and a kind of again getting back to people who are tech savvy or not, it's can you look at your portal? Can you print me your lab? I'm not in one of those lab systems that my patients are in. And sometimes it's great, they're savvy and they can just show me. And other times, I have to go through a labyrinth to get stuff. So it's just, I don't know if it needs to be this hard, but we'll see.
Well,
it's the trend, but that having the access to the charts is really good. I'll tell you a funny thing. While I was sitting waiting for test results to come back, I got my test results back before I even got back in to see the doctor. Right. So I knew what was wrong. And I said, I saw it. And they went, yeah, did you? I thought that was weird. I was like, oh my God, I've been sitting here for 3 hours and here it is. It's right here on my phone, I already know. Don't bother. Let me go home. That was, and I think that's part of it too, is not everybody is a techie person. And I mean, it took me a long time to figure out how to do that. And it changes, and how much do you really want to know in your chart?
Well,
exactly.
Really I mean, I can't tell you how many people are looking at their pathology report before someone is knowledgeable is explaining what's important and not. There's a double-edged sword to this for sure.
Yeah. Or reading what they wrote about you.
Troublesome.
Yeah, very, very troublesome.
You guys want to talk our next meeting?
Yeah, I'm seeing that Carol from FLOQ popped on.
I'm thinking that's Friends of Lake Q. Carol, would you like to add anything?
Can you hear me okay?
Yeah.
Okay, good. I apologize, I'm arriving late to the meeting. I just saw that you had Lake Q water quality, and I've been a member of the FLOQ for the last 2 years, and we've created a water quality committee, and we've been in touch with a variety of people to just understand better about what is being, if the lake is being tested, and what's the protocol around that. And so I thought I'd jump on the call. I don't want to extend your meeting because I am late, but didn't know if you'd talked about Lake Q and the water quality, or maybe we could do a sidebar conversation about it. But I'm very curious to see sort of the Board of Health input and sort of discussion around water quality for Lake Quannapowitt.
Yeah,
we
I
did
think
discuss it a little bit earlier. Yeah, Anthony, you can speak to it a little bit more.
yeah, I was gonna say thank you for coming on, Carol. I think
Sure.
yeah, kind of the long and short of what we described earlier was we talked about some of the history, and Elaine and Laurel have been on the board for a while, so they were able to kind of provide us with some of the history, especially with the Board of Health's work with Lake Quannapowitt and Friends of Lake Q. So we basically talked about how we should be working closely with Friends of Lake Q moving forward. We did talk about the swimming quality, the water quality of Lake Q, and just based on some of the circumstances the lake is in, we're not really sure that it would ever be at the swimming water quality, but we are looking to continue to work as a town to work with Lake Q. So I don't know if you saw, but 2 nights ago, Town Council actually passed an order. So $800,000 have been dedicated towards the cleanup of Lake Q and some of the surrounding area. So they're going to be dealing a lot with surface drainage into Lake Q.
The Friends of Lake Quannapowitt wrote a letter on behalf to get funding to go towards the Main Street project, and which is supposed to be putting a water quality best management practices on about 8 to 10 different outfalls. Because the only way really to clean the water quality is catch it before it goes into the lake, or you have to do some extremely expensive method to remove it from the lake. And historically, this lake, I agree, may not ever become swimmable. We can hopefully just make it better over time. So that's kind of the goal of the FLOQ. So yes, we're happy to hear that money went towards that, because we're working with Bill Renault, and he asked us to sort of help him with trying to find ways to fund that project. I also was part of the negotiation with CCNF, the new development at the head of the lake, where we were able to negotiate the 1.3 million also be contributed towards that project. So hopefully, with the combination of what the town may already have, that they can move forward with that project, because that's going to will have the bigger impact to water quality as a whole.
Yeah, that sounds good. And we also talked a lot about communication. So, we talked about how a lot of residents, in the past had known Lake Q as kind of a swimming place, but I think for us to have clear communication on some of the safety measures, like you just mentioned, if you're in the water, you want to shower off, that sort of thing, we should make that all very widely available. And so our plan was to reach out to you guys, and I think before the peak season of use again in the spring, we want to be able to have something on the books, including the yacht club and the Boys and Girls Club that use the lake for water activities very frequently. Talk to everybody about what they see as needs in terms of communication are, and we want to get those out to the town before the use picks up again.
Yes, no, I think that would be great. I'm the chair, a board member, and also the chair of the Water Quality Committee. So I'd love to sort of be the connection with you to see how we can continue the communication on this particular topic, because it is top of mind with several of our board members to see what we can do to kind of just understand sort of how to communicate out to the people who want to swim or want to enjoy the lake, other than just gliding over it with a boat, because we get asked all the time. So we are trying to be very conscious of the fact that we indicate to it is not swimmable. We do note the current 4 signs that are out there from the Board of Health that indicate that, but a lot of people I'm afraid that are fishing in there and doing other things that we need to make sure that they're fully aware of that. But I'd love to to stay connected. I appreciate you taking a few minutes here to explain sort of what you had discussed and sort of what your thoughts or your program will be.
Yeah, we appreciate you jumping on and providing some perspective, and I think it's it'll be a good partnership, I think, moving into the spring here. So
we rarely have subcommittees because the subcommittee is one.
Well, we've over the last 2 years, the FLOQ is now, I help them rewrite their whole bylaws. I'm a civil engineer by trade, so it's kind of what I do for a living. So I was able to kind of get them to reestablish a whole new set of bylaws and a structure, and then look at different committees that were focusing in on what's most important, and they never really had a focus on, they always kind of discuss water quality, but it was kind of all over the place. So I said, we need to sort of have that streamlined communication about it and connect with the right players to make sure that we're all on the same page. So I'm glad that I was able to kind of connect, and the meeting wasn't over by the time I got on board.
Carol, how often do you meet?
We meet monthly. So we meet monthly as a board, and we also meet monthly as a committee.
Carol, would you be able to send us your information just so we can add it to the minutes? You could email it to me, or you could email it just to the board. And we'll add it to the minutes so that we have it and we can reach out to you when we meet again.
Oh, absolutely. Yep. I have, let's see, what's the right way to, would it be Candace?
Yep.
Or how do you
I think you can email it to Candace. You can also email it to the Board of Health at wakefield.ma.us, and I think everybody will receive that.
That's right. Yep.
Oh, perfect. Yep.
And we'll make sure it makes it into the minutes so that we have it there.
No, I can certainly do that. Not a problem.
Thanks, Carol. Appreciate you being here.
Thanks. No problem. I'm going to sign off. Take care.
Okay.
Thank you.
Yeah, bye-bye.
Cool.
Okay. Anthony, you're good?
I'm all set.
Anybody else?
Just Anthony, what's going on with Stoneham?
Oh, thank you for the reminder. So we had a city council meeting in the city of Melrose Monday night. They voted in favor of entering the agreement. So the next meeting for Wakefield will be November 28th, and that will be on the agenda for consideration. And so between now and the 28th, we'll try and get the information out about that agreement. And Stoneham has their own process. I think it's a town, just based on their charter. So I'm meeting with the Stoneham Board of Health next week to discuss this as well.
So I think we learned this on our first round. And as I've said in earlier meetings, I mean, it dumbfounds me that the boards of health have no power over these agreements, nor are we ever asked our opinion by the governing body. So I'm putting that on record that I don't think that's, I mean, it's fine that you're informing us, but I really do think that in retrospect, I would have liked to have seen town administrator present to us as a board as to how that would look. But, you know, we're now in it. I would recommend that we really look at a work pattern and that we really utilize a fairly organized organizational chart. Because you know, already it's hard to have a health director in 2 towns and going across 3, and that 3rd town is going to be pretty, you know, we know from experience it will be pretty needy. So, you know, our job as a board is to, you know, really be sure that Wakefield is managing and managing well at the high quality that we have come to be expecting. So I think that that's important. Madam Chair, you haven't had an opportunity to speak with the administrator, I'm assuming?
No, I'm not. No, I found out from Anthony also. Yeah.
So it's just, you know, in the past when we've done this, you know, I don't know. I think we're, you know, looking. I think we've been functioning so well for so long. People are like, no, you're doing a great job, and well, you know, we kind of stay out. But I think that, you know, that there is process, and it does dumbfound me that we, you know, so I guess our mission is, you know, once we have our, you know, our work, that's what we do, and we do policy. But this decision affects our work, and so I may reach out.
I think I understand what you're saying, Laurel, and sometimes it's what you call professional courtesy.
Yes.
To, you know, notify your boards that, you know, something's going on and things like that. I done that before as a director, always notified them that something's going on in the department.
Yeah.
And I think it is, but I think that one thing we really do have going for us that we didn't have before was, I think, the staffing. I think our staffing between Melrose and Wakefield alone is very good. And our grants that we have with extra people, I mean, you don't know how long, you know, we're looking, I think we have what, 3 years on the, oh my God, the excellence grant, right? And then we have
well, actually, we only have a year and a half, roughly a year and a half left on that.
Oh,
It's been
wow.
time flies, Elaine.
Oh yeah, after all that work. But that may be renewable, you know.
Maybe,
that.
maybe, it may be renewable.
That may be renewable.
I
And
don't
I
make
think
any
a lot of
guarantees,
them,
but
yeah, but they are.
Chapter will be over. The big one.
Yeah.
yeah,
Yeah, but
DFC ends in a year. Yeah, so those are 2 major grants, and we have a couple other smaller ones, but yeah, DFC and PHE are the two major grants right now.
But I think that's one. I think the model that we have set right now is a good model, and I think it's a better model and a stronger model than we had in the past.
Yeah.
Because remember, we were the first ones to do any kind of thing. We're combining health departments, and now it's very common in the state of Massachusetts. There are quite a bit, and there are in the works many other health departments that are doing the same, are going to follow us. And they're going to end up, it's been in the works for about 5 or 6 years, and COVID put them back. But there's a lot of talk again amongst some of the communities. We've heard it. I've heard it at meetings, and I think we're going to see more and more do it. But I think we have a great boards, we have great office staff, we have great workers, and I think now with all our staffing between our inspectors and everything, I think we have a very solid group, but we are a good example. And I think we will be able to carry the example and be okay. I don't know, but I understand what you say. It's common courtesy.
It's just
professional common courtesy.
We've done, but at any rate,
yeah, we have done a lot.
My only other thing just to think about, just Anthony, I don't know if you worked with the health director in North Reading, but we have someone from the North Reading Coalition who pops in to our meetings. We had a conversation about Kratom.
Yes. And, so I actually wanted to give you a heads up. So we owe you guys another appearance from Maureen Busby very soon. So we've been talking about Kratom a lot recently, and we also both went to MHOA. The first day of MHOA was very tobacco heavy and other related substances. We do have an update on Delta 8 products as well, but Kratom has been on some people's radar for some time now, and so it's taken off. Yeah.
Well, I was told that the very progressive board at North Reading, and I'm like, I'm sorry, is actually considering doing a local Kratom ban. You know, and so what's difficult is Kratom's not illegal, right? So
correct.
The very first call that they got was from the lawyer for the producers, and so I just think it's something, you know, it's another chapter in substance use mitigation to kind of follow. So I just wanted to put that out to our awareness and keep people, you know, to follow.
Yes, we'll have a whole meeting dedicated just for that, because I think Kratom itself is there's a lot of stuff going on. It's a hallucinogen. It can be used, you know, obviously recreationally, but there's some self-medication going on just because there's so little known about it. But
and then before our next meeting on December 6th, we're going to do In Plain Sight again. So In Plain Sight, we've always done with the police department. We're doing many. Catherine's working on a sign up. I'm hoping to participate, and I've asked the person from North Reading just to send us what they have on Kratom so that we can include that in our item board and things to look out for.
Yeah, Kratom comes in so many consumable formats. There's Kratom drinks now, Kratom powders. You know, there's so many.
Teas or things that you. Yeah. But there's a few towns on the South Shore that have Kratom bans already.
Oh, do they? Interesting.
Yes.
Yeah, it was like pre-COVID. There was a lot of movement. It's on the South Shore region related to Kratom. Yeah.
All right. Thanks. Okay, I got nothing else. I'll stop talking now.
Elaine?
No, I have nothing else except for I thought we were going to traditionally cancel a December meeting like we always have.
I was just about to say I don't want to overrule Laurel, but
I think we need a month. I mean, we've always had that tradition unless something comes up. You know us, we will, because technically it would be what, the 21st?
Yes, it would be.
Yeah.
Correct.
I mean,
Oh, yeah.
I'm afraid I'm not doing anything. I mean,
No, if that's the tradition, maybe you don't remember, but I don't know anything about the tradition because
Wow.
I was hired in 2019. And then it all just
I think we should, like, you know, average out all the emergency meetings we had in 2020.
we met every 2 weeks. So
yeah.
you let me know how things are.
I mean, weekly updates on Friday.
Yeah, exactly.
Ugh.
Do we want to tentatively think about January 18 then?
Sure.
That would be the third week of January.
That's fine with me. And then let
Okay.
us know if, like, we need to present anything.
I think you may have a better idea of what's going on with Stoneham by then, you know, between the holidays and all the charters and who's got to look up this and that. We may have something better. And that
I
may
sure
be
hope so by then.
Yeah.
Yeah,
Well, I hope so.
And I think, Anthony, have you talked to the board members about how Stoneham, like all of this will be contingent upon like them agreeing to staff their department?
Correct. Yeah. So, I mean, there is going to be an MOU in place basically to ensure that there's going to be a minimum level of staffing, that meets our requirements, so that we're not going to be diluted, into that work. So, just one piece of assuring that this won't turn into kind of a decrease in services. So,
Gotcha.
Yeah.
Wonderful. Good job, everybody, as always.
Very lucky to have the staff, to have Erin and Dan with us. We are very, very lucky to have these people with us. Let me tell you, I as a former health director, as Erin will tell you, I love to read their reports. I love to know what's going on. I miss that stuff every day. Don't get any ideas, Anthony.
I have a part-time opening, Elaine.
Oh yeah. Another job. Let me add that one.
Yeah, and Dan's doing a great job. We're both having a lot of fun with the trainees because they're bringing a great energy and they're very eager to learn, and it's going really well.
Good.
Hey, Cindy, I see that we had closed captions, so I don't know if that makes it easier to capture the meeting. You can cut and paste if you see that. It says it's
Yeah, I see that. Yeah.
Oh, really?
Yeah.
Yeah.
Transcript recording on.
Yeah. No, it's perfect.
Awesome. Never noticed that before. All right. Happy Thanksgiving, everybody. I make a motion
Oh.
to the meeting.
Yeah, but we got to do a motion. Did you set the date? And we are correct, January.
January 18, tentative date, and I'll take a motion to conclude the meeting.
Okay.
Okay, I'm making the motion to conclude the meeting. It's 7:28. So I wasn't sure which this clock was turned. This fine evening of November 16th.
And the motion to close.
All in favor?
Aye.
We're gonna go with bath time now.
Aye, Silva.
Yeah, we'll bath time.
Linehan, aye.
99. Happy
I know,
Thanksgiving,
yeah.
everybody.
Bye,
Bye,
everyone.
everybody.
Safe
Bye.
travels. Thanks, everybody.
Good night.
I did.
Oh,